Welcome to Helen on Let's Talk Health, formerly known as Let's Talk Health. Those of you who have to look after very active children or pets, do you find that you can't quite keep up with them? Do you have painful and stiff joints that hinder your ability to participate in sports or hobbies such as playing the piano or painting? If you say yes to some of these questions, then you might have osteoarthritis. Let me find out more information from Dr. Christina Choi.
Hello everyone, this is Dr. Christina Choi again. Today I'll be discussing another topic of interest as of late called osteoarthritis. Now, osteoarthritis is a condition that we will all eventually come across as we age or go through wear and tear. Today we will discuss some of the signs and symptoms of osteoarthritis, some treatment options, and also what we could do in terms of exercise down the road. Now, a lot of times we know osteoarthritis as arthritis itself, but if we were to break down the term, osteo means bone, arthro means joint, and itis itself means inflammation. So to define it, osteoarthritis is a degenerative joint condition. It's a disease that involves thinning or destruction of the smooth cartilage that covers the ends of bones, causing changes to the underlying cartilage and joints. Now, OA is a short form for osteoarthritis. OA can affect many joints in our body, especially joints that actually go through a lot of wear and tear. If you look at the image here, okay, you will see a healthy knee. On the top here, you have your thigh bone. On the bottom, you have your calf bone. Now, covering these bones is actually joint cartilage. Joint cartilage is a protective layer that prevents the wear and tear and to prolong the bone itself. Allows flexibility, and then joint fluid allows fluidity. Now, over time, if we do overuse these joints, or if we have an underlying joint condition that breaks down the cartilage itself, we have something called osteoarthritis OA. Now, in this image here, you'll see that the white part, which was the cartilage that protected the bone, has been damaged due to overuse, okay, due maybe wear and tear of grinding, or even excess physical activity. When this happens, the cartilage wastes away, and what you have is bone and bone contact. And when bone and bone contact happens, you will have bone spurs. Bone spurs are just excess bone that the body starts to lay down as a healing process. However, there is no definitive way of how the bone lay down. So the bone can actually cause more problem over time. Hence, bone spurs causes, more inflammation, the pain of a bone rubbing against each other, as well as a lot of loss of range of motion. Some of the symptoms of OA itself include stiffness in the morning, okay, can come with or without pain. Now, the stiffness in the morning usually lasts for about 15 to 20 minutes. That's because when you start moving, these joints do feel a lot better. However, as the day progresses and you do move a lot more, there comes pain and discomfort because you have put a lot more pressure into the joint itself. So at this time, resting is actually the thing that you do that provides some relief. Now, if, for example, you have OA or we have something called an arthritic attack, okay, the joint itself may become inflamed with pain, it feels warm with a lot of swelling. You will notice that the specific joint that is affected will lose a lot of range of motion, and any structure surrounding that joint can become painful as well. So aside from pain and stiffness, okay, the muscles around it could start to weaken. You may not want to move it or bend it or even walk on it as well. So if you see in this image here, it just shows you where arthritis can happen. Of course, these are the most common areas. Like I said, there's a lot of joints in the body, but usually you would see OA in the knee because we stand a lot, we walk a lot, we run, we put a lot of pressure on our knees. Our foot, okay, our foot does carry our whole body. Our hands, just because we use it a lot, whether it's to do chores, to type at the computer, or with daily activities. Our hip, okay, and our spine. So what are some of the risk factors that comes with OA? Family history. If you do have a family history of arthritis or any joint problem itself, there is a high chance that you may get those conditions as well. So if you know if someone in your family does have, degeneration, arthritis, you just have to be very careful maybe of your diet, the way you work out, or just your physical activity level. Another mention of risk factor is lifestyle. Do you sit a lot? Do you exercise a lot? Do you put a lot of impact on your body? However, even lack of physical activity can actually predispose you to arthritis just because your joints are a lot weaker. Excess weight, okay, if you could imagine, if you have more weight on your body, okay, a lot of your joints, especially your weight bearing joints such as your hip, knee, and ankle, toes, will have to carry a lot more in terms of your body content. So a lot of studies, actually some studies have shown that an extra pound on your body, okay, is actually 4 extra pounds, okay, of pressure going into your weight bearing joints. That could include your hip, your knee, ankle, and toes. Another risk factor is overuse or injury of joints. Overuse could be, overusing your hands. Maybe you're typing a lot, or if you're doing a lot of physical activity, or if you're a mechanic, you have to carry a lot, lift heavy products, lift heavy tires, okay? That could be an overuse and can predispose you to developing OA. Even certain physical activities, okay, from young to old, if you do more of, like running, okay, can actually damage the knee, but you just have to be very careful with the use.
Today, we have learned about the symptoms and risk factors associated with osteoarthritis. Next time, we will learn about the diagnosis and treatments and how your diet can affect osteoarthritis. You may want to watch the previous episodes on poor posture by clicking the link at the end of this video. And please remember to subscribe to this new channel, Helen on Let's Talk Health. Until then, stay safe and stay healthy.